Hi, this video is the art of hair transplant restoration surgery. This is right before surgery, and the client's kind enough for me to show his head before that. He's kind enough to willing to come in once a month for me, us to do a follow-up documentation, because I think it's very fascinating and to have the documentation right before surgery and when the hair starts to grow out, and help other clients to see and understand what's to expect. But for this client, what we want to do is like right before surgery, 2 weeks later, and then once a month later. and it's not only help him, but help other clients to understand what's they like, because other client did it once a month, and it helped him quite a bit, and now he want to return the favor and do it. And I'm very excited for it because I know he's going to have excellent results. Very young guy. Unfortunately, he has a class 6 hair loss pattern, and he's heading toward that. So we're gonna, what we do is hair transplant. Again, it's an art form. It's not just throw it up there and pray that it will grow. So basically, on average for Asians, from the mid-eyebrow to the hairline is around 6.5 to 7 centimeter for Asian and African American. For Caucasian, it's from the mid-eyebrow to the hairline is around 7.5 to 8.5 centimeter. And then we depend on your facial structure. We build around the custom hairline for facial structure. So for him, we start down the bottom with slightly curved on both sides. You don't want a big old arch and have a big giant forehead. We understand the idea of mature hairline, yet at the same time, you want to create the hairline that looks so natural that as if when he walks down the street or sit in front of people, you can absolutely certain that no one knows he have had surgery is done. So that slide was slightly curved from both sides and dipped down in the middle. I've been offering him a widow's peak if he wanted to, but he preferred not to. He never had it, but some patient had it before, so we can recreate it. And even you didn't have it, and we can still create it for you as well. Can you turn to the right for me? There you go. Yeah. And you can see how, well, we slightly arch up. Again, it's not a big old giant arch, it's slightly arch up. And then the idea is not only bring the hairline down, but we want to be proportional vertically or horizontally as well. So his currently hairline has receded backwards like concave shape, so we're going to bring it in. So we have a nice, we bring it in horizontally and vertically as well. If you can turn to the other side. And you can see we did slightly curved. Again, we brought it down and bring the temple. And once we get the shape that we wanted, that fit his face, again, when I study at UCLA and do my training in Beverly Hills, I came from an art background. So not every surgeon is an artist. You want to create the hairline that looks the most natural hairline, and that's what I'm known for. Density is given. That's the surgical skill. So once we get the shape down, we're gonna, the front row, we're gonna give them zigzag of of a lot of single hair grafts, soft hair grafts, to feather it in to make it look natural. The more what do you call it? There's 4 types. There's a soft zigzag, which is the bigger zigzag, and it looks very natural. However, the drawback is it looks less dense as compared to the smaller zigzag, the tighter zigzag, or the medium and the medium tight. And then the one with almost no zigzag, those are reserved for like celebrity or African American, because the hairline is almost a straight line. So that's that. And then we plant it starting on 35-degree angle and work our way toward the back for Asian and other ethnic. But for African American, the hair tend to hug the skin more, so it starts around 10 to 15 degree. And again, we feather in baby single hair graft in the front, 2 or 3 and 4 hair in the back for bulk and volume. And so go back to the middle. And I'm very excited for him, because we explain a lot of the artistry behind it, because we want the audience to understand that hair transplant is not like our father hair transplant, our grandfather hair transplant, where we don't pay attention to the aesthetic or the artistry behind it. You just be happy to have hair. Nowadays, having hair is not good enough. We want to have hair that's good and excellent density, but a hairline that's natural as well. And stay tuned. We're going to try to do a 2 weeks after surgery, and then once a month. Thank you. Oh, by the way, look all the way down so the audience will appreciate how severe hair loss he has. All the way down more. And you can see that's how significant that is in class 6. So we're going to give it to show the audience. Okay, thank you.